mountain was. And at the same time, you were designing the mountain because our behavior was going to design the mountain and design the plateau and the peak. When will the virus stop? When you stop the virus, is what the experts would say to me. It was like a cruel riddle every day. When do the deaths stop? When does the infection rate stop? When you stop it. What does that mean? When the social distancing works, when the close down policies work, when the masks work. So you're climbing a mountain and you are designing the curve of the mountain. It ends when you say it ends, right? This was traumatizing for people. And on a personal level, economic level, it was frightening, it was isolating. Everyone had their own demons they were dealing with. I had my own demons and my own fears. I'm afraid for my mother, afraid for my kids, afraid for my brother. Everyone had their own pain and their own trauma to deal with. But what we went through and what we did was historic. Because we did tame the beast. We did turn the corner. We did plateau that mountain. And then we came down the other side. And they will be talking about what we did for decades to come. It really was an historic moment. Personally traumatic, socially traumatic, and historic. So, I love history. I love poster art. Poster art is something they did in the early 1900s, late 1800s, when they had to communicate their whole platform candidacy on one piece of paper, right? You wanted to run a campaign. They didn't have TV commercials. They didn't have mail. They didn't have any of these things. So they got their whole message on one piece of paper. And it always fascinated me. I use so many words. What if somebody said, okay, no words. Paint me a picture that tells the story of what you're trying to say. That's poster art. And it's helped me because it's been like a relief valve. Not that I don't have joy every day dealing with you guys, but I could go and just use a different side of my brain. And this was the most famous, the William Jennings Bryan with the octopus. He's fighting the octopus, and the octopus is corporate trusts that are taking over the economy, right? You could almost do that again today. So over the past few years, I've done my own posters on that capture that feeling. I did this one for the State of the State, ship of state that was sailing in this sea of division, right, back in January. Well, in any event, so I did a new one for what we went through with COVID. And I think the general shape is familiar to you. We went up the mountain, we curved the mountain, we came down the other side. And these are little telltale signs that, to me, represent what was going on. That big arrow that goes right up through it, that was the economic models, right? We needed 120,000 beds, we needed 140,000 beds, and those models shot straight up. We had to bend the curve despite those models. We needed 30,000 ventilators, that model said. We almost get to the top of the mountain, economy falls. Get it? Economy falls like Niagara Falls, but then the economy drops, the economy falls. And the economy comes running down. Timeline on the bottom from day 1 to day 111. It's roughly scaled. And then little visuals of what was going on. Starts on day 1. Little octopus is the tell, back to the William Jennings Bryan poster. Zach got that right away. First comes on a cruise ship, the COVID virus, right? We start the daily briefings. It's Jim Malatras and Stephanie Benton. Hand sanitizer. We have the winds of fear are blowing. Everybody's afraid. We have the plane bringing 3 million people from Europe, and that's how COVID came, through the clouds of the federal government, CDC, etc. Testing, hospital surge, Javits Center. We're pulling down the curve together, right? 111 days of hell, the New Rochelle hotspot, first hotspot cluster, testing, tracing, nasal swab, cute little button nose. I'm driving once again. One of the few benefits of this. I get to drive myself now. Subway disinfection. We've turned the corner, mask up, social distancing. The sun is on the other side of the mountain. We just had to make it to the other side of the mountain. There's the man in the moon. It's just the flu. Phase 1, we're now coming down the other side. Boyfriend Cliff is there. Tell the people the truth, they will do the right thing. They made the boyfriend look like Zach Fink. I'm not sure why. Who's pulling down the curve? New Yorkers, healthcare workers, the essential workers, out-of-state volunteers. 30,000 people from out of state volunteer to come help us. I have my 3 daughters there. That's Captain. They have him a little paunchy. He's on a diet. He's not that bad, but he's on his way. Stock market reopens. We come down the other side. There's the briefing table. Out of state ban. Follow the facts. It's Arizona, Texas, Florida going up. Last little sign, caution ahead, caution ahead. We climb the mountain, we're down the mountain. Be cautious, what we're talking about today. Do compliance, watch people from other states. And we're still in the sea of division, which I talked about in January. Even worse, George Floyd murder, racial tension, protests. Even worse than it was. So, New York tough, smart, united, disciplined, loving, in case you haven't heard that before, because love wins at the end of the day. Love is the rainbow. Timeline on the bottom. We forged community, and community wins. And you were part of it. And I'm going to give you a poster, because you were a part of it. Andrew.
Governor, 2 questions. First, I thought you had indicated at the end of last week that you yourself might travel to some of the other states to provide some assistance. If you went to one of these states, would you self-quarantine?
No, essential workers don't have to self-quarantine when they come back. I'm an essential worker.
Second question has to do with your threshold.
I think I'm an essential worker. Some people would say I'm not that essential, but.
For your threshold for schools, you talked about the percentage testing positive with the floor being 5% and the ceiling being 9%. Given that New York is somewhere around 1% right now, if you were below it, but up to somewhere around 4% at the time you're making the decision, and maybe Jim wants to weigh in on this, might that be an alarm bell right there?
Yeah, well, look, yes, you can follow the number. That's what's nice about this. There's no politics, there's no personal opinion, there's no vagary. Look at the number. You're at 1%. Okay, as long as you don't go over 5, you have a green light. If you see 2, 3, if it's a consistent basis, then yeah, start to worry. Because if the number's going up, the number goes up. And if the number goes over 5, you hit the red emergency button. So if you see 2, 3, 4, yeah, you're probably headed for 5, unless you do something very dramatic very quickly.
Governor, I wonder if you could respond to AOC's comments, I believe it was yesterday, regarding an uptick in violence in the city. She said it's probably the result of people not having rent canceled, people needing to steal bread. I think experts would say that's really not the case, at least when it comes to shootings. I'm wondering, number one, your reaction to that. Is that the kind of comment that ends
Well, look, an incorrect, I don't know what she said, so I have no comment on what she said, but people have theories. An incorrect theory doesn't wind up being correct because there's a void. And I think we have been talking about what's going on. I don't think there is one answer, but I think you raised a good point last week. I think there are a number of contributing factors. And you put all those factors together, and that's what you're seeing going on. There's no one factor, and that's why it's a little more complicated. You know, in politics, they want to be able to say it's just this. It's not just this. There are a number of factors. But I don't think, you have violent crime, which is murder, et cetera, more than robbery, I think the violent crimes have been more drug-related, et cetera, on the facts. Yeah.
On the rent issue specifically, though, as I'm sure you all remember, the governor did an executive order back in March that said there couldn't be any evictions on commercial or residential rent through June. We then extended that for anyone who was COVID hardship related through the end of August. In the interim, the legislature passed legislation that said that you can't be up for any rent evictions during this crisis, which is a bill that we signed, I think, a week and a half ago. And so I'm not sure how it could square that it's people that are concerned, like not able to pay the rent, when right now there are no evictions on the table legally. So.
Yeah, it is factually impossible that somebody committed a crime so they could pay their rent. If you can't pay your rent, you cannot be evicted right now.
And if I could just ask about the nursing home report, I want to get your response to criticism that it wasn't independent. Maybe Jim can weigh in on this also. Specifically, one of the issues they raised was that it did not include deaths in hospitals from people who were nursing home residents. Does that make bad data going into the report, and therefore the report doesn't have good data coming out?
They use the publicly reported data, and the curve shows what the curves. The facts are the facts. So I think it didn't material impact the overall outcome, which was the timing of the fatalities happened well before any of the admission policy. That the workforce itself was a driving factor because that's when the infections came in early on. So those material facts would not be changed one way or another. But we're basing it on the public. The Department of Health was basing it on the public data that everybody has.
It's where you count the death, Zach. If the person goes into the hospital, passes away in the hospital, we call that a hospitalization death, as opposed to trying to trace how long did the person have to be from the nursing home into the hospital, or you'd have to do it the other way, back it out of the hospital deaths, increase the nursing home, and reduce the hospitalization. But, you add the two numbers together, it's the number.
There's testing supplies and PPE are increasingly in short supply nationwide. How much progress has New York hospitals made towards realizing that 90-day goal that you set in early May to stockpile PPE? And how does that 7-state consortium you also announced about that time play into that?
The consortium is more of a longer-term production mode. If you put those states together, can we manufacture our own? And does one state have the capacity to manufacture masks, and one state have the capacity to manufacture gowns, and one state have the capacity to manufacture the reagents for the testing, et cetera? The 90-day PPE is going to be a firm regulation. They must have 90 days of PPE. One state have the capacity to manufacture masks, and one state have the capacity to manufacture gowns, and one state have the capacity to manufacture the reagents for the testing, et cetera. The 90 PPE in their own stockpile. Lesson learned. And that's a state reg.
Any idea how many days New York City would have on hand at this point?
They should have 90 days on hand now, or they would have had to get a waiver from the Department of Health because they didn't have the cash flow or something like that. But I've not heard of anyone getting a waiver.
And just to the governor's point, and it's the 90 days at the highest burn rate, which is the requirement at the peak of a new wave or something like that. And we're tracking this. Many of the hospitals We track it regionally as well, have more than 90 days. They've actually gone extra cautious. Some have 120 days worth of materials. So we're tracking all of that. I don't know of any waivers either, but we'll check on that.
That did not apply, Zach, to testing equipment. That was only hospital PPE.
Governor, Christie would really suggest two things. What is your response to seeing the zero deaths in New York City for 24 hours of the site might be possible to see zero? The potential of the state, you think? And also, does the state plan to provide financial resources maybe for schools that won't be reopening?
Yeah, what was the second question?
If the state plans to provide financial resources maybe to school districts that won't be opening the fall and do e-learning and plans to provide extra resources.
Yeah, I don't think the state funding formula goes by legislation now. It's a set formula for every school district in the state, 700 school districts. I don't think there's any variance in the law that would allow you to shift funds from one school district to another. On the death rate across the state, look, it is very, very good news. That's why I literally say congratulations to New Yorkers. We followed the data. We have a model that worked. It worked all across the state. It is working. We are reopening. The other regions outside of New York are even further down the road on reopening. And the numbers are all good. Yes, we have compliance issues, especially downstate New York and Long Island. But it's been great news. I want to look ahead. You know, if it was just today, I'd say great, all great. But we've all learned the hard way. Look ahead. What's the next shoe that could drop? I'm worried about people coming to New York. You are not a hermetically sealed bubble, right? Somebody lands in New York, they come through Rick's Airport, they come through JFK, LaGuardia, Newark Airport. I remember the first positive we had was a health worker coming back through the airport. And I remember what that started. First case. What Uber did she get into? Who at the gate did she say hello to? Where did she pick up her bag? What Uber driver? Who did she shake hands with in her hotel lobby? You know, it came in through the airports. It will come in through the airports once again.
Concerning the newly introduced air ventilation rules and protocols, if or when applied to offices and retail locations, do you believe this might eventually pave the way towards an extension of the 50% capacity limits?
It could. Look, the air filtration to me, when we talk about being smart, right? What have we done in New York? We've been smart. Why? Because we're smart. And common sense. Look at everything you can. This air filtration is a major function. It's not the most sexy of functions, and you won't hear many governors talking about air filtration. But you have a filter that can filter out the COVID virus? Wow. Why aren't you using it? We then ran into all sorts of complications. This HVAC system fits it, this doesn't, et cetera. But we put out guidance. The HEPA filter is the best for those systems that can take it. Otherwise, you have to have a MERV 13 for a large congregate setting is the best, or down to a MERV 11. That's the floor and the ceiling, if you will. But I'm excited about the possibility, and we'll see how it goes. If the infection rate stays down, then you're going to see us continue to increase the capacity. And if the air filtration is one of those devices that keeps the infection rate down, great.
Where are you going to apply to the?
Sorry?
Where are you going to go to one of these other states maybe?
Yeah, we're talking to a few states, and we're seeing what they need and the best way to get it to them.
I was listening to the
Yeah, I don't know what you're listening to, what they're saying, or what it actually means. So we'll see what guidance they put out at the end of the day, and then we'll take it from there. Sir?
Circle back to the rules of not taking gun violence in the city. During his press conference this morning, the mayor tied it largely to widespread availability of illegal guns on the street. You just said that you don't tie the uptick to one single cause. Do you agree with the mayor there, or do you think that there are...
I have not heard that there was an uptick in the availability of illegal guns. Is there?
That's what the mayor pointed fingers at when he was talking about the reason that...
I haven't heard of that. Have you heard of that?
No, and I would just caution that last week it was bail reform, and it was the chokehold ban, and it was Rikers, and then it's rent, and now it's this. I think that this is a really complex issue that is really incredibly important to the safety of the people of New York, and that people should refrain from tossing around theories with no facts behind them.
Yeah, or let's someone who didn't answer. Yes.
Last week you said, if I'm next time, I would like to be on this side of the table. And I'm a very educated questioner. If you were here, two parts of the question, what would you ask Governor Cuomo, and what would you ask Andrew Cuomo?
Oh boy. I would ask Governor Cuomo, did you really design that poster, or did somebody else design that poster? Was that really you, or did somebody else do that?
And your answer would be?
I would say, if the answering is me, I would say yes, I designed it. I resent that question. I don't like the implication of it. I think it was personally derogatory and hostile. So yes, I said I designed it because I designed it. What would I ask Andrew Cuomo, separating him from Governor Cuomo? I would ask Andrew Cuomo, how are you doing through all of this? And when you look back, what do you think? On a personal level. I would say that's a personal question, and I think it's inappropriate to ask me at this venue, and I'd get a little defensive. And then I would say, I think at the end of the day, we will actually be stronger as a society for what we went through. I think my family is stronger as a family for what we went through. I would say it was the hardest thing I've ever done in my life. I think it was the hardest thing a lot of New Yorkers did. But I think I am stronger for it. I think my family is stronger for it. I think we're stronger for it as a society. On the theory that that which doesn't kill you makes you stronger. I just hope we never have to go through it again, and I hope this nation gets the message and those other states get the message, so we save lives in this country. And if they follow what New York did, we will save lives. And nothing is more important than that. Thank you, guys. Thank you very much.
Thoughts on using detention centers or other spaces for schools? Has that been in the discussion?
Any school district that wants to propose that can.
Oh my God, the truck is sinking.
Devastating flooding has reached catastrophic levels.